I'm Lorie from Queen Creek, Arizona. Well, I actually started out as an assistant 15 years before I became a hygienist. So I loved dentistry since I was little, and I know that's odd because most people don't have good experiences from that far back of their childhood, but I did. I had a dentist who loved children. In fact, he had his own special dental chair just for the kids. And he'd lean you back and you'd see kites and things on the ceiling, and it was fun. And he would just be so gentle. I never knew I was getting a shot. If I had to have an injection, he would always say, I'm just putting a little sleepy juice alongside of the tooth, and I got a toy if I didn't cry, but there was nothing to cry about, so hey, it was great. So I had positive experiences since I was a little child going to the dentist. And so I decided that I wanted to do that even when I was a small child. I couldn't believe, why would the assistant know what to hand the dentist and him not even ask for it? And I just loved the passing of the instruments, and I started watching her mix the material, and I just thought it was exciting. I know that's kind of silly, but I really liked it. So when I started having my family, I went to assisting school and got my certificate for assisting. I did that for 15 years. I was happy doing that. I could have done that forever. However, my husband at the time, he ended up with a disorder that caused tumors to grow in his body. And what happened was he had one that developed in the brain. He had several lesions in the brain. I knew then that this disorder could take his life. So I went back to school because I wanted to be able, I wanted to prepare for the worst, but, you know, live life happily. And so that's what I did. I went back to hygiene school and got my degree so that I could depend on myself, and those children, if that they depended on me, they could just depend on me. So that's why I actually became a hygienist. It was a good plan. I started out doing hygienist in '97 is when I got my license for that, and absolutely loved it. My husband, unfortunately, actually did end up dying from his disorder, and then I was able to support myself on that. I had no worries. Hygiene has been really good to me, and I love hygiene. I love teaching and educating the patients, and dentistry's just worked out really well for me all the way around. A lot of science has found different areas of how we can keep the patient's teeth longer just by what we know about periodontal disease and infection in the mouth, how inflammation not only affects your mouth but affects your whole body. And that's exciting because now I'm not just treating the mouth, I'm not just treating the teeth, but I'm treating the whole patient. I'm able to help them to be healthier all the way around. And that's exciting for me. The more I can learn about what I do and the new research that's out, I'm able to teach and pass that information along to any patient that I see. And that's exciting. Come in, absolutely, because we're here to help you. We have the best care here. You're going to get treated like a person in this office. When you come here, we put the patient first, and that is awesome. We all do that. We have a great team here. Our team works really well together, and it's all about patient care. So.